So there are numerous products that we kind of lump all together as dermal fillers, or we just call them fillers. Some names you might recognize: Juvederm, Restylane, Radiesse. Now we have a couple of others: Artefill, Belotero. I really like to just decide right at the time of the visit with the patient which filler we're going to use. There's a lot of little subtle nuances. Radiesse, for example, is a little stronger and stiffer, and so it might be better used in these areas. Belotero is very thin and malleable, so often we'll use it up here in the tear troughs. But the basic idea behind dermal fillers is simply that it's kind of like medical grade spackle that we're putting underneath the skin, and we're pooching things out. That's really all it is. But basically we can treat people in many areas, anywhere where you have a depression, and this is sort of the first area that people get and that are eventually treated. The nasolabial folds, they get deep. And then this area, and this is my favorite, because again, we're pulling down and people think you're sad. Again, these are vertical lines that pull down, and you look sad, or, you know, and it's amazing the difference that can be made. Not only do you look, you know, more youthful or better, but you just absolutely look happier to have this all gone, okay, right in this area called the marionette lines. This might be number 2 for some people, the nasolabial folds, or, Allergan has a name for them as well, which is called the parentheses. So people will come in now, see advertising works, and say, I have the parentheses, I need to get rid of them, and we can certainly do that. Recently, we've started to do other areas. Cheek augmentations, for example. We've come to realize that the aging face kind of sinks down. It's not necessarily gravity, but you can consider it that way. The fat that was previously way up here in the apple of your cheeks kind of comes down here. And so we put a little bit of filler up in this area, over in this area. It's called a cheek augmentation. I do see a lot of people running around with overdone cheeks, in my opinion. They look like chipmunks, and I don't like that one. So I'm very subtle with that, because we'll look at it together. That's generally how we do it. We'll put a little in, look, do we want some more? Both of us agree or disagree. We figure it out ourselves, myself and the patient. Another area that we treat are the tear troughs. People feel that they have bags, or they have dark circles, or they protrude in this area. And sometimes by putting a little filler in there, that can mitigate that look. It's a little tricky though. It's subtle, it's technically a little bit difficult. So I make certain that we always use a hyaluronic acid filler, such as Juvederm, Belotero, or Restylane, because we have medicine that we can inject to eat it up. It's called hyaluronidase. In case it just doesn't look great, or it looks a little, uneven or whatever. So it's nice for myself and for the patient to realize that, if something isn't great with this, we can fix it. So that is an area that we do it well, and we can, it is technically difficult, but we can, always make the patient happy with that. There are some side effects potentially. The most common by far is bruising. And this always annoys me a little bit, because bruising is a result of the needle hitting a vessel underneath the skin. So there's nothing that any practitioner does or does not do that makes bruising worse or better. If the patient's going to get a bruise, they get a bruise. There's nothing anybody can do about it. We can't see the blood vessels, of course. But there are some things that can be done. For example, it's important that patients avoid aspirin, Motrin, any of those sorts of products that can lead to increased bleeding, which is bruising, for 10 days prior to getting their injections. Also, sometimes people will take a medicine, it's an herbal medicine called Arnica montana, which helps make bruising go away more quickly. The use of ice prior to and immediately after is helpful. Most patients do not bruise, but even if you do have a bruise, you can cover it up with makeup and it's gone in 10 days. Very rarely you can see some of the filler. That's extremely rare, and usually that can be resolved by the injections that get rid of it if it's a hyaluronic acid-based filler. Every once in a while you'll get a little lump underneath the skin, and we can usually inject that with the medicine. So those are very rare. The majority of people just have it done and it looks beautiful. As far as how long it lasts, typically the fillers will last anywhere from 9 months. In some cases, the longer lasting fillers, for example, Artefill, can last for up to 5 years. It's a long lasting filler. Now that we use only in certain areas in certain circumstances. Typically just in this area, we have to inject it deep. But it's a very lovely filler. It's very natural looking. And obviously it has that tremendous longevity, so that's something very desirable. The thing about fillers is they make people feel really good. You look natural when it's done properly, just like anything else really. And it just gets rid of things right there. It's so fun to do it. It's such a great time when we're here injecting patients with filler because they look in the mirror, oh my gosh, it's gone, that looks amazing. Even though they might have little blood dots for a minute, you know, and a little bruise. It really just adds to their sense of well-being and the fact that they're looking as good as they can.